My name is Jeffrey Lehman. I'm an otolaryngologist and I practice in Winter Park with offices in downtown Orlando and Celebration as well. Well, I've been practicing medicine from the time that endoscopic sinus surgery was actually introduced into the United States from Germany. I did my training prior to the endoscopic techniques, and then during the middle of my residency we started doing endoscopic surgery, so that's been 27 years. Chronic sinusitis is associated with symptoms of nasal congestion, postnasal drainage largely, sometimes pressure and headaches, but less commonly than is experienced with acute sinusitis. In the patient population that I deal with here in Central Florida, I have a lot of performers, and those vocal performers will suffer significant deterioration in the function of their vocal instrument associated with sinusitis, both chronic and acute. I first met Julia when she came to Orlando from the University of Wisconsin after she finished her doctorate there in music. She was having issues with her voice that were related both to recurrent chronic sinusitis as well as some reflux issues. Julia had undergone sinus surgery prior to coming to Central Florida, and she continued to have problems with recurrent issues. I did a revision procedure on her a number of years ago, and she did well for a while, but then recently has developed persistent sinusitis issues and symptoms centered in the ethmoid and frontal areas on both sides, despite the fact that these areas had been adequately opened up with prior surgical intervention.
Over the past few years, I've still gotten sinus infections, less than I used to, but I got a particularly bad sinus infection right before this third surgery. And we tried antibiotics to eradicate that, and I started getting allergic to a lot of the antibiotics that we were trying.
The reason why I thought about employing PROPEL in her instance was the fact that there was polypoid change in the ethmoid and frontal region. Even though the frontal sinuses had been adequately opened from the standpoint of removing obstructive bone from the area, the polypoid mucosa was closing things off at this point, and the secondary infection from backup in the frontal sinuses was affecting her other sinus areas as well as her voice. I reasoned that using PROPEL up in the area would help deliver steroids directly to that mucosa that had been so inflamed and swollen and was obstructing the frontal outflow, and that would give her significant benefit.
Well, I really trust my doctor, so when he suggested that we use these PROPEL sinus stents, I was on board right away. I thought it sounded kind of interesting, but I was really happy with the idea that it would keep swelling down and keep everything open in there during the recovery.
I wanted to take her somewhere where PROPEL stents were offered. I brought her to Winter Park Hospital, which is one of the Florida hospital campuses here in Metro Orlando, where I can use this new technology. I was able to do her procedure there, place the PROPEL stents, and she's done remarkably well since. Within 2 weeks after the procedure, she was having symptoms far reduced from what she was feeling pre-operatively, and she's symptom-free at this point.
So with the PROPEL stent, I think it made a huge difference in easing that pain and just allowing me to live my life and get back to what I was doing so much more quickly.